Hello, my name is Dr. Ibi. I welcome you once again to this channel, Beyond the Consulting Room, where I talk about issues that concern your human dignity and well-being. In this video, I want to talk about medical checkup because sometimes we face the challenge of not coming up with an appropriate list during a medical checkup encounter. Sometimes also we are not sure how often we should do medical checkups. So we end up adopting the easy way out, trying to do everything for everybody every year. But that is inappropriate. Okay, medical checkup should be tailored to a person's personal characteristics, like the person's age, the person's biological sex, the person's personal history of a disease that can make that person prone to other diseases, the person's family history of having certain diseases should be considered in that list that we come up with during a medical checkup encounter. So if you take age, for instance, we know that prostate disease or prostate cancer happens in males, but we also know that it happens in older males. So there should be an age you should start screening people for prostate cancer. Okay? And even how frequently you do that screening depends on certain factors, like a family history. If somebody who has a brother or a father who died of prostate disease, that person could be screened more frequently than somebody who has no such history. All right, so then you don't do everything for everybody every year. Now, if you have two people, like a 19-year-old and then a 40-year-old, whom you are trying to screen for hypertension, okay, now, what the chances of the 19-year-old having hypertension at 20 years is so low when you check and the BP is normal. But the chances of the 40-year-old having hypertension at 41 is still high. Okay, so if you want to decide, okay, I've checked two people's blood pressure, they are both normal. One is 19, one is 40. When again should I check their BPs? For a 19-year-old, at 20, the chances, the risk is low. At 21, the risk is low. At 22, the risk is low. At 23, the risk is still low. So you could say that, okay, let me do it for this 19-year-old in the next 3 years. But in the 40-year-old, at 41, because of the age, it still has a higher risk than the 19-year-old. So at 41, you can do it every year for that person. So then, frequency of doing the checkup depends on a number of factors: family history of disease, the age, and so on and so forth. I'm just saying that the idea of doing everything for everybody every year, it is not appropriate. Okay? Now, another clarification I need to make about medical checkup is that medical checkup can take the form of checkup done for somebody who is traveling. Okay, it's a requirement for obtaining a visa, checkup for somebody who is getting admission into a school, checkup for acceptance into a job. Okay, these are one-time checkups, so these are not the kind of checkups I'm talking about. I'm referring to periodic health maintenance programs that you adopt. Okay, sometimes call this wellness clinics or clinical preventive services. Okay, and there are four major types or components, I should say, of these clinical preventive services. So if you are going for a preventive service on a personal level, you should look for these four components. The first one is screening. Second one is immunization. The third one is preventive medication. And the fourth one is counseling for health behavior change. We should be up to date on all these four components of these clinical preventive services. When we talk about screening, many people think that screening means labs. So you can go to a lab, laboratory, and then go and get some labs done. You're looking for a doctor to show that to. No, screening involves taking a history. We need to know you in terms of family history. How do we get to know your family history of certain diseases? It's through taking a history. How do you get to know if you have a disease that can predispose you to other diseases that we need to check through the labs? Is by taking a history. Okay, how do we get to know, all right, that your blood pressure is high? Is by doing examination. So it is not by doing labs. We get to know through examination your weight, your height, and calculate your BMI. So then screening involves not just labs, history taking and examination as well as labs. Okay. Then also, when we talk about immunization, I'm not referring to mass immunizations like COVID-19, vaccination, for instance. No. In some jurisdiction, you do vaccination for children under certain ages, all right, to protect them against certain diseases. That's not what I'm talking about. I'm referring to office immunizations, where you can walk into a facility and want to do vaccination for hepatitis B, for human papillomavirus against cervical cancer. In some jurisdiction, we do vaccination for zoster virus against influenza. For vulnerable groups like the elderly, we give pneumococcal vaccines to prevent pneumonia in these people. So we can do immunizations as part of your medical checkup program, okay? And you should be up to date on that. All right. A third component of your medical checkup or your clinical preventive service program should include preventive medications. Now, preventive medications are medications you give not to cure a disease or to manage a disease, but to prevent some diseases. So if you are a female and you are planning a pregnancy, you should be put on folic acid to prevent a defect in your baby. In some jurisdiction, if you're at high risk of having heart attack, having a stroke, you can be put on aspirin, you can be put on cholesterol medications, okay? In some jurisdiction, where there are women who have a family history of breast cancer, such women are put on some preventive medications to prevent breast cancer in such populations, okay? In some cases also, some are given some vitamin D or calcium supplementation to prevent osteoporosis, okay, in some at-risk groups. So these are called preventive medications. Then a fourth component of your checkup or your clinical preventive service or of your wellness clinic should include counseling for health behavior change. They'll counsel you for assess you for smoking, alcohol misuse, inappropriate diet, or lack of exercise, and then offer some counseling and guidance. If you're an adolescent, especially, we need to talk about risky sexual behaviors, preventing STIs. All these are counseling for health behavior change. Okay, so medical checkup is not doing everything for everybody every year. It should be tailored to an individual's need, such as based on your age, your biological sex, your family history of a disease, your personal diseases that you have that can predispose you to other diseases. Medical checkup means much more than screening. Okay, it means vaccination as well. It means preventing medications. It means counseling for health behavior change. Okay, and screening is more than labs. Screening involves taking a history and performing an examination. Okay, and you can get a lot of information from this book. What you need to know about medical checkup. It has specific information that can help you come up with a medical checkup list for you. You can use this book with your health provider, come up with a list for you that is appropriate for you. Okay, thank you very much for watching this video and subscribe to my channel. Thank you.
Presenting 4 life-changing books by Dr. Abraham Amponsah. Positive Health, Health Beyond Pills. Becoming the best version of humanity. What you need to know about medical checkup. The right treatment for the right disease. Visit www.drab.org for your soft copies, and for your hard copies, call or WhatsApp 0548 696904.